Welcome to the Brighten Heights Vitality Series, Episode 12, Protecting Your Cardiovascular and Respiratory Health. Thank you all so much for joining today. Today's webinar is sponsored by Brighten Heights, and Brighten Heights will be a first of its kind senior living community located in Pewee Valley, Kentucky. It is promoted to promote a life of healthy living and change amongst seniors and is expected to welcome its first residents in 2024. For more information on Brighten Heights, you can visit our website, which is brightenheights.org. Here in a moment, I will introduce Dr. Youngberg. But first, a few housekeeping items. Please feel free to ask questions through the chat window, or if you are joining us through Facebook Live, feel free to leave your comments in the comments section. We will monitor them throughout and we'll ask your questions at the end of the webinar. The Brighten Heights Vitality Series is for informational purposes only. This episode does not constitute medical advice, and so you are advised to seek your opinion of your healthcare professional. Now I'd like to introduce Dr. Youngberg. Dr. Youngberg's primary focus is in his daily practice at his medical clinic, the Lifestyle Medical Clinic. He is an assistant clinical professor at the Schools of Medicine and Public Health at Loma Linda University, and a fellow and founding director of the American College of Lifestyle Medicine. He has written 3 books, Goodbye Diabetes, Hello Healthy, and Memory Makeover, and regularly speaks and writes publications on these topics. So Dr. Youngberg, we're so happy to have you again here today. And in the last episode, we discussed the upside of health challenges and the barriers to optimizing cognitive and overall health. And today we'll be discussing some ways we can protect and support our cardiovascular and respiratory health. And Dr. Youngberg will be sharing some tips on how we can navigate these hurdles so we can stay on a path to success. Now I'll turn it over to you, Dr. Youngberg.
Good to be here with you, Susan. And I think it's important to comment first on how we came up with this topic. You know, how do we come up with this integration between optimizing cardiovascular health or circulatory health and respiratory health? And of course, this came to us. In fact, it was your idea, because you had recently been through a little crisis in your life, like so many millions of people have across the United States, of experiencing COVID for yourself, not just vicariously through others, but experiencing it for yourself. And of course, you had the advantage of having already some insights from what we've talked about before, but in particular, you had an interesting experience how this influenced your respiratory health as well as your circulation. So before we get into the do's and don'ts and the different strategies that can be helpful for all our listening audience, why don't you tell us your story of what happened when you had COVID?
Well, very good. Yes, I'd be happy to talk about that. So my experience was that my daughter came home from a trip, and she's 13. She was feeling dizzy. And so next thing we knew, we had her tested and we found out she had COVID. And then my oldest daughter and son-in-law, 2 days later, they came down with it because they had been on the same trip. And I went into mother mode and started taking care of all of them. And then by Thursday, this started on Sunday night, and by Thursday, I came down with symptoms. But because I had been in mother mode, I really wasn't thinking too much about my own health. And so I made some key mistakes, as we've discussed since then, looking back. And that was I wasn't resting, and I didn't start the hydrotherapy from the moment I knew I was exposed. So I think those 2 things are big contributing factors to how things went for me, but also my age is probably a factor as well. I just turned 60 this year. So at any rate, my experience was that I started having breathing issues, and those got worse to where I felt like it hurt to breathe. So I finally, my husband was having some similar issues as well. And of course, a lot of fatigue, et cetera, and felt like we were probably dehydrated because we just didn't feel like even drinking enough. You get to that point with this process sometimes. So we went to the ER and found out that I had pneumonia in my right lower lobe of my lung, and got some medication, got a Z-Pak, but also my doctor prescribed a steroid, which I think helped the most with getting through that. But to that point, in talking further and of course doing research, that's when you educated me that, it's really micro blood clots that are causing the breathing problems. And so that was fascinating to me to try to understand that better. And then my doctor, when I asked him, okay, both the ER doctor and then my doctor said, take aspirin every day to thin your blood and prevent blood clots. Well, I reached out and said, well, how long do I need to keep taking this aspirin? I'm now no longer symptomatic. And he said 3 to 4 weeks. And I'm like, why? But it come to find out that this blood clot issue is still a risk factor, even after you're no longer having the symptoms. And then the other thing that happened, and I feel like Lucille Ball, it seems like things happen to me and in retrospect are kind of funny, but I waited at least 3 weeks after I was no longer symptomatic to try to go exercise, because I could tell with the steroid that I was gaining weight, because steroids after a while make you eat more, or make you want to eat more, I should say. And I hadn't been exercising, so I could tell I wasn't as fit. And so I go to my boot camp, and I promise I didn't do as much as everybody else was doing. I felt like I was trying to ease back into it. But by the time it was over, about an hour later, I had chest pains, and I didn't know if it was from doing the push-ups or if it was something more severe. And I reached out to a doctor, and who is a friend of mine. She's not my regular doctor, but I reached out to her and she said, well, I'm not convinced you're not, that you're out of the woods. So you should just go to the ER anyway, just to play it safe. So at 11 o'clock that night I did, and they did a CT scan and an EKG and took my blood. And at about 2:30 in the morning, they said, you're fine, you can go home. But by the way, wait another month before you exercise. So I did. And I just started back up last week, made it through the whole week of exercising and did just fine. But it was, really a learning lesson. And it's just been fascinating me to understand better what all's happening in the body with this particular virus, and then how to navigate through it. So when we talked about this seminar we're having today, I said, I think it would really be helpful for people to understand with COVID, particularly what's going on with this blood clot issue, but then also what is the interrelationship between your cardiovascular system and your respiratory system, and how they work together, and what you can do to protect it and navigate this process. So there you have it.
All right, thank you so much, Susan. That was a great story. People like to hear stories. And because we can most easily apply that information to our own lives as well. So what I'm going to try to do here, relative to your own experience, is share some ideas of what anybody, those watching this program, can potentially do to prepare to be able to go through an experience like you did, with the least possible amount of side effects and the lowest possible risk of that condition becoming more severe, and certainly leading to potential death, right? So the only two, actually the three concerns that we have with COVID is, number one, we don't want to die from it, right? And so everything that we can do to prevent that is very important. Number two is that we don't want to end up with a serious condition, because that's, where we have to be hospitalized, because that dramatically increases the risk of having long-term complications and potentially dying. And then the third area is not letting this go into a prolonged, chronic, long hauler scenario. We called long COVID or post-COVID sequelae, whatever you want to call it, is persistent negative symptoms, primarily fatigue. Okay, but I mean, I just worked with a patient this morning who 2 months ago had COVID, and he's still only about 50% back to normal after 2 months. And the main symptom is fatigue. He also reported that he's got some significant brain fog. So the COVID had a major impact on his cognition. He says he still can't remember some of the things that happened during that period of time because he basically doesn't remember. He has amnesia about it. So there's the inflammatory aspects of any infection like that can really be bad for the brain and predispose us to have cognitive decline later in life. So we don't want to do anything that allows the likelihood of developing Alzheimer's or impaired cognitive function over time. So a couple of things that come to mind immediately. You mentioned what the interrelationship are between respiration and circulation. And the finding that we learned early on in the process, even well over a year ago, is that the main issue with COVID is the oxidative stress that is developing in the body, in the circulation, that then leads to thousands of little micro blood clots to form that are basically causing the circulation everywhere in the body, but including through the lungs, as the blood circulates through the lungs, to get rid of carbon dioxide, the waste product of energy dynamics, and to collect oxygen and then transport that oxygen to the brain and to the heart and to all the working cells of the body to stay alive and function. That circulation becomes impaired. It's kind of like the difference between jumping on a freeway late at night or at a time when there's hardly any cars on the freeway and you can get where you're going really quick, or jumping on the freeway right in the middle of the worst traffic jam possible, right? So yeah, we can visualize that. That's essentially what's going on with this microcirculation or micro blood clot scenario associated with COVID. The people die from COVID because of blood clotting primarily. And so the lungs cannot transfer gases or bring in oxygen and therefore keep us alive. We end up suffocating when the lungs aren't able to work properly. So a couple of things that I think are very important for us to consider as we're planning for this next fall and winter season, where I think we would be remiss not to expect a lot more problems with infections and COVID and other respiratory infections. So we need to be ready for whatever comes our way. I hope there won't be as many problems as last year, but there's always a new variant apparently, right? So far, there's always a new variant coming out that is basically breaks through any impact that the vaccine has had. So we want to be ready and be prepared. And so here's a couple things that I want to address. First of all, is another analogy, and that is, you mentioned that you had pneumonia in your right lower lobe, and the one of the important things about optimizing circulation early on is doing deep breathing exercises. So this is something that anybody can do at any time, where you literally will just take a deep breath and breathe from the diaphragm, where you're allowing your diaphragm to expand. And as your diaphragm expands, okay, that will force more air into the lungs, and not just in the upper areas, upper lobes of the lungs that are more active most of the time, but it forces that air into the lower lobes of the lung, which are basically kind of shut down most of the time, unless we're out walking or exercising or doing some type of activity that is that is more intensive, requiring a faster breathing rate and a deeper breathing. Those lower lobes of the lung are just basically shut down. There's no blood circulating through them. And so that's why we want to make sure that we're optimizing that. And just deep breathing exercises basically is a passive way of doing exercise to get more oxygen into our body. And so taking a very deep breath for 5-6 seconds, and then letting it out for 5-6 seconds, and then another deep breath in, doing that for a minute's time. Sometimes we'll feel a little bit lightheaded if we do that, but it would be good in normal times to do that even once an hour, just to make sure that we're fully oxygenated. It's when we oxygenate the blood at the highest level, we're lowering inflammation. We're lowering the risk for cancer. We're basically lowering the risk of almost all chronic disease because we're optimizing energy dynamics in the body. So doing deep breathing exercises can be very, very helpful. Now, if you're sick, if you're starting to feel various symptoms associated with respiratory infections, then it even becomes more important to do some deep breathing exercises, as much as is reasonable, depending on your symptoms, because that's going to further improve energy dynamics, and that will force blood to start circulating through those lower lobes, reactivating all those immune cells that are just basically marginated to the sides of the blood vessel walls, right? If there's no circulation, those white blood cells that are sitting there are not doing anything for you. They're not fighting bacteria. They're not fighting viruses. They're not fighting cancer. They're just literally on R&R doing nothing. As soon as you start doing deep breathing exercises or anything that improves circulation of the lungs, you get a dramatic flushing of those white blood cells back into the bloodstream, where they can now be your soldiers, right? Be the soldiers that are killing viruses and other microbes to help heal you. So, number one, deep breathing. The other analogy I want to mention here is thinking of your lungs like a big old bundle of bubble wrap, right? And so you have your lungs have all these little like grape-like clusters, like little bubble wrap pockets, where oxygen can flow in as you breathe especially deeply. And as oxygen flows in, that expands those little bubble wraps that then forces more blood to flow around that little bubble wrap or grape-like cluster, that then helps transport oxygen from the lungs to the rest of the body, and the waste products, the carbon dioxide from the body out through the lungs as we expire and breathe out. So that's the connection between circulation and respiration. Respiration is the way we actually get the goods into our bloodstream so they can be transferred to the rest of the body. Now, I want to share with you a couple of things that I would tell any of my patients, and I've done this myself. And I'm gonna share a screen real quick, that so you can actually see. Okay, can you? This, I think you can see this screen. Give me a verbal confirmation, Katie or Susan. I see you shaking
Yep.
your head. Yes. Okay, good. So this is, I just basically typed into the Google search area. I just typed in oxygen concentrators, and And I happen to have this one. This is the Philips Respironics Everflow oxygen concentrator. It's a very popular brand. Of course, there's many brands that are very good. And at the beginning, about 2 years ago now, as I was starting to recognize that we were in for some serious couple years of dealing with COVID, I actually bought one 5-liter Everflow, and I also got a 10-liter. Now I've never had to use them. Of course I've experimented with them. I wanted to have them at home to take care of my family, to take care of potentially people in my neighborhood that wouldn't have access to hospitals, right? That's still a very significant reality, especially what's going on with nursing and doctor shortages at many hospitals right now because of all the politics going on. There, we have far few doctors and nurses available now going into the winter months than we had last year. Okay, and so I think it'd be wise for all of us to be ready to be able to take care of things at home as much as possible and actually support other family members and even neighbors around us. So I have 2 of these units. I have a 10-liter unit and a 5-liter unit. Now, what that means is that you're getting 5 liters of pure oxygen pumped through, and it comes through a cannula, that basically a little clear tube that you can put around your ears, and then it has 2 little spigots that go up into the nose area, and you can just breathe in this pure oxygen along with the regular air that you have, and that dramatically increases your oxygenation potential. So now there are some of us that could qualify to get something like this just from a prescription, a doctor's prescription. Most of us, though, aren't going to qualify for that because we don't need it at this moment. Okay, and so what I would do in a situation like that, and this is what I did, I just went on Craigslist. I mean, and that's just one example of ways that you can find these products available without a prescription. And everywhere I've looked, anybody can find, especially right now, because they're available right now. I wouldn't wait 2 months because they might not be available in 2 months, but I just go on Craigslist and find a new oxygen concentrator preferably that does up to 5 liters a minute. You can have as little as half a liter a minute. You can turn it up to 5 liters a minute or more, and you can get those for under $500 brand new, which is really inexpensive, really cheap, and it's your backup plan to take care of respiratory potential problems. Okay, so that's one. Now, the other thing that I would recommend, okay, is having your own pulse oximeter. Okay, pulse oximeter, and so I'm just gonna Google this real quick, and let's go see. There we go. I'm just gonna share screen again to show you this. I had no particular brand allegiance here. Let's see where.
And while you're doing that, I got one at Walgreens, I think for like $20.
Yeah. So, but I just wanted to show a picture. So sure. Here are pulse oximeters. They basically clip on your finger. Okay, here we go. They just clip on your finger like this, and then they'll read out your actual oxygen level. And this is really good. A 99, oxygen level is really good. You don't want that to drop under 93. And if it drops under 90, you got to start talking to your health professionals. And of course, this is also a form of biofeedback, because you realize when you put that pulse oximeter on, where it tells you your regular heart rate as well, but you can actually experiment with deep breathing exercises, okay, and see how dramatically your oxygen levels can change by just doing some deep breathing. You can actually see how just having good posture can be so helpful. Just paying attention to having your shoulders back, sitting straight up, standing up, not having stooped shoulders, breathing from the diaphragm, concentrating on slow, steady, deeper breathing techniques. All that increases your oxygenation levels in your blood. And that means that your blood is richer in oxygen and able to improve the immune system more, and of course, feed your brain and your other organs more effectively. So everybody should get, if you don't have a pulse oximeter at home, you should have one. In fact, I recommend that every home have 2 pulse oximeters. That one that you, especially if somebody gets COVID, you don't want to be sharing that pulse oximeter between people who have COVID and people who don't, right? So if somebody in your home, a family member or a guest, has COVID and they're living in your home, they should be in their own room, have access to their own bathroom facilities, and they should have their own pulse oximeter. So ideally, what I did is I had enough of these for every family member. And again, they're not that expensive. So, and if a neighbor were to need one and can't access one, then you can potentially lend them one. You can always wipe these down, by the way, with alcohol wipes, and you could use them that way as well. So that's the pulse oximeter. Now I'm going to share a screen again I'm actually going to put in. There's another thing I strongly recommend that everybody have, and that is a nebulizer. And there's a website that I just like because it's all about nebulizers. So it's called justnebulizers.com. Okay, and I've just typed that in, and my internet is taking its time. Wow. Okay, let's try that again. Just nebulizers. Wow, it's not working here. There we go. So just nebulizers. Now, so this is a company that has all kinds of nebulizers. Of course, you want to shop around. There's a lot of places that you could go. Let me tell you the ones I like the most. I like the travel nebulizers because they're portable and you can have them everywhere you go. And they're basically battery operated, so you can charge up the battery. I actually have both of these right here, the Omron Mesh Nebulizer, okay, and I have the more expensive Inospire Go Portable Mesh Nebulizer. Okay, now what these do, okay, and again, you can shop around. They're not cheap, but a good one, you want to have a good one. I got this 2 years ago, and then they were not available for a long time because at least this one wasn't, because it was so popular. And apparently it is now available again, but it'll probably not be available in a couple months' time, especially when people realize they do a lot better. If they have any type of respiratory symptoms, you can do a lot better with a nebulizer. The purpose of a nebulizer is that you can basically put any liquid medication into the nebulizer, okay, and then using either the mask or just putting it right in your mouth and breathing it in through your mouth or through your nose. You can breathe in whatever is being nebulized, whatever medicine, liquid medicine you have put into the nebulizer. And the reason I have added this information in this discussion is that I think this is probably one of the most critical things to be aware of, is that you can, if you take advantage of like nebulizing or even just using liquid iodine, where you can pour this liquid iodine like potassium iodide that's dilute, called liquid iodine forte from Biotics Research. That's one example. Some iodines are more irritating, so you got to be careful. You don't want to just put any old iodine into your system, because they can be irritating if you spray them or nebulize them, and they're more of a if they're like a typical betadine form of iodine, which is not really designed for internal use, you can really irritate the sinuses from that. But you can dilute those. There's actually studies showing that you can take 10% povidone iodine and dilute it, and then spray that into the nostrils. You can use it as a mouthwash and then spit it out. You don't want to swallow it, but that will kill COVID and any virus within 15 seconds. Now, so you can either nebulize iodine or other antivirals like colloidal silver, etc., or you can spray it directly using a snoot spray cap. That's a vertical spray cap that is a fine mister. Okay, so those are things that can be done to dramatically change the course of your own infection, dramatically decrease the risk of you infecting other people, and even as a pure preventive strategy to dramatically decrease the risk of you getting infected from somebody else. So, for instance, here, I forgot that I had this right here. I have these everywhere. This is just this liquid iodine forte that I mentioned, with a little. It normally comes with a dropper, okay? But I have this little snoot cap, this vertical mister, okay, that will basically spray. So I'm going to show you. I'm going to demonstrate for you how I use this. Now, why this is so important is because this will kill viruses within 15 seconds. Now, I've actually. There's tons of studies on this. I've known about this for decades, okay? And I assumed it would work for COVID when I first started studying COVID. And in fact, I was able to find studies that showed it was completely effective against SARS-CoV-1, right? That initial, even more deadly type of COVID. And it was even effective against MERS, which is really a much more deadly form of virus than what we have now. Okay, and so I knew a long time ago this was going to be effective, but now we have all kinds of studies showing how effective this really is. And wouldn't you know it, because of that, articles were coming out on social media saying, "Oh, really? You're gonna snort a little bit of liquid iodine up your nose, and that's gonna prevent COVID? Come on!" You know, it basically it was making fun of it was the fact that the studies actually showed it to be effective. And then some doctors were even saying, "Yeah, okay, yeah, it works, but we don't know how long it works." And I'm thinking to myself, wait a minute, so who cares how long it works? If it kills the virus, it kills the virus. You know, it doesn't have to keep working for another day because you've already killed the virus. And so you've essentially done the job that needs to be done at that point in time. And then, you know, 2, 3, maybe 4 times a day, you do 2 or 3 squirts in each nostril. So I'm going to demonstrate for you right now. Okay, so it's basically, this is regular dilute 150 micrograms per drop liquid iodine, potassium iodide, okay? And I just close one nostril and then do 2 to 3 squirts with the snoot cap on each nostril. Close the other nostril and then breathe it in, and it basically goes right up into the upper sinuses throughout the various sinus cavities. And you have a little bit of a runny nose for a little bit because, you know, you got iodine flowing through your nostrils. And but you can actually visualize, based on the many studies demonstrating this, that as that goes through your intestinal various sinus cavities, you're literally killing the virus, you know, and it happens very quickly. And so you're dramatically decreasing the dose, right? The dose of virus. So that virus, it takes usually a couple of days to go from your sinuses or your throat area to your lungs and therefore into the rest of your body. So if you can prevent that from migrating to the rest of your body, you've done your job, right? Not only are you preventing the viral load from replicating endlessly to the point where you're just, infecting everybody you come in contact with without even knowing it, because you got so many millions of viral particles coming out with every breath and every time you talk. But you're dramatically damping that process down. So a very powerful strategy that all by itself, and by the way, I'm not an advocate of one thing. You know that if you've been watching the series, I'm an advocate of always asking the question, what else can I do, right? What else can I do to be healthy? What am I missing? And so this is a powerful adjunct or additional strategy, but it's one of the most powerful strategies because it's so simple to do. Every morning when I shave, I just do, 2 to 3 squirts in each nostril. And anytime I go out into the public where I'm interacting with other people, I just do that ahead of time and maybe afterwards. I'm not stressed about it. I'm not anxious about it. I know it's going to help me. So it's one of the many things that I'm taking advantage of. So that is another strategy that I personally take advantage of in this process. So now, Susan, we got to come back to your story here because you mentioned to me, and I've heard this over and over and over. As much as I, champion the value of the liquid iodine, I also believe, as you mentioned, that there's nothing that appears to be as powerful to address this from a respiratory, circulatory standpoint than hydrotherapy. You use that term very quickly, but we need to make sure that our viewing audience clearly understands what that is and how they can themselves do it simply. So tell us your experience with hydrotherapy.
So I started out just doing the contrast showers, on my own, which is 3 minutes hot, 30 seconds cold, 3 times in the shower. And as hot as you can stand it, and then as cold as you can stand it in the shower.
Basically, you're getting that hot water right on your upper chest area and on your upper back area. Literally as hot as you can stand it for 3 to 5 minutes, depending. And if you're feeling a little cold, make that hot last a little longer, so that you should really feel like unpleasantly warm by the time you're done with that initial hot shower. And then you go as cold as you can take it. And I mean as cold as you can take it. So if you live in the Midwest or out east where the water is really cold, unlike in Southern California where I get a little bit cold, but it's more lukewarm for you guys, right? I try to get it as cold as possible, but get it as cold as possible for 30 plus seconds. And that's actually almost a relief, right? When you're coming off of that hot where your body's really warm and you need to get that cold water just feels relief. Now it also kind of takes your breath away initially, but that it's that contrast of hot to cold and that differential between really hot and really cold that actually dramatically activates your innate immune system, which is the whole reason you got COVID in the first place. Your innate immune system is on a R&R break. It's not paying attention. It's letting the virus replicate as if, we don't have to worry about those guys. We'll be fine. And all of a sudden, boom, they get overtaken. So you do that back and forth 3 times. Keep going.
And then when I got so fatigued and was having all my breathing problems to where I couldn't really safely, or just didn't want to, for that matter, get into the shower and do that, then my daughter started doing Fermentations on me, which basically was, putting wet towels, wringing them out, and then putting them in the microwave, getting them really hot. So I think she's doing them for up to 10 minutes, and then putting them inside a garbage bag, placing that on my chest and my back. I was laying in the bed, and of course, a towel in between wrapped up so you didn't burn. And then pulling the sheets up and the blanket and everything, and then just laying there for, like 5 minutes. And then she would alternate that with an ice cold washcloth, where she would do what they call cold friction, where she's just rubbing really fast, and really creating that same contrast that you're talking about. But again, it's focused on the chest. And the whole while you're trying to not get chilled, so that you got to be careful with that part of it as well. But again, trying to get that circulation going and getting your immune system to kick in.
Now, what's really interesting about that, just to clarify how that is done, what you do here is you're optimizing. You're using a like you said, a wrung out towel. You got to wring it out really well. You got to get it wet and then wring it out really well. Because if you don't wring it out well enough, and then you put that in a trash bag to hold the heat while you microwave it, and then you take it out later. If it's soggy with water, that's going to burn you big time. It's going to burn your skin. So you don't want that. So you want it wrung out well, so it's damp but not soggy. And every microwave is different. Some microwaves you do it for 5 minutes or 4 minutes or long. You just do it long enough so that towel is nice and steamy. And then you basically fold that towel, okay? And then you wrap a dry towel around it, and then you put a towel down on the ground below, and then you basically have a towel, a hot towel now on your back, okay? And then a dry towel on your chest, and another hot towel that's a damp hot towel on top of that. And that's how you do the hot fomentations, or generally 5 minutes time. And then you do the ice mitten friction, which basically is cooling off that area, forcing the blood to move in and out of that area. Hot draws blood towards it, cold draws blood away from it. So that combination dramatically enhances the innate immune system function. If you do a cycle of 3 sets of that, 5 hot, 30 seconds cold, 5 hot, 30 seconds cold, 5 hot, 30 seconds cold, always ending with cold. And then you dry off really well, you get in bed or wrap up with a sheet and a blanket, and just try to sleep or rest for at least 20 minutes, preferably 30, 40 minutes. And that rest phase dramatically enhances the body's ability to make your own antibodies, called spontaneous blastogenesis. So your white blood cells, your plasma cells are making tons of antibodies that are against the entire virus, not just the spike protein, but the entire virus. That's why individuals who've had COVID have by far the best immunity, certainly compared to those who've had the vaccine. So you're able to dramatically enhance your immune system, both for now and for the future, even with other variants that come our way. So that's the use of fomentations. Now, tell us more about your experience with that.
Well, so I don't know if I could say that we did enough of that, but the bottom line is, it definitely, both my experience and my daughter's experience and son-in-law's, that of all the strategies we were implementing, during that COVID episode, it was the hydrotherapy that when we did that, we felt the best. Like we could tell our body was trying to get well, so to speak. Energy level and all of that was definitely improved every time we would do that. So I think it's very critical, not only for, like you said, well, primarily because it's kicking in your immune system, but also you just feel so much better, and then can sleep better, etc. Well, I know we're nearing the end of our time together. I was wanted to ask one more question, or actually, I have a question here that was asked, and that is, how can Brighten Heights, once Brighten Heights opens, how will Brighten Heights be in a position to help future residents with their cardiovascular and respiratory health? And a couple of things I want to bring to mind with that. One is, well, actually three. We'll be very focused on continuing education. You know, these types of webinars are awesome because you can go back and watch a recording if you can't remember everything you learned. But ongoing education is going to be a big part of what Brighten Heights is all about, so that we will continually be reminded of strategies that we can be implementing to improve and maintain our health. The second thing I want to highlight is that we do plan to have hydrotherapy as part of our available amenities and services, so that whether you're doing it on a recreational basis, like almost like a spa experience, you know, I just want to go in and have a hydrotherapy session. It definitely feels good, but you know, also for illness related, certainly will be something that will be available for that. And then thirdly, we will have I refer to it as outpatient therapy, but we're going to have a therapy space and have professionals available, whether it's physical therapy, occupational therapy, or respiratory therapy, available for residents in those situations where they may need access to a respiratory therapist. And one more thing I'll say about that is, when I was going through my COVID experience, I had a respiratory therapist friend that I reached out to, and I said, all right, help me better understand what's going on here and what I need to be doing now that I'm past my symptoms, but I can still feel I have some pain in my lower right lobe, and I just my energy level's not back. I don't feel like I can take as deep a breaths yet. And he's like, all right, Susan, well, now you got to be in therapy mode with your respiration and start trying to improve your respiration. So he had to get a incentive spirometer, which basically is just like what you would think the word incentive. It's giving you the incentive because you're seeing what levels your breathing is taking it to, and you're trying to get it to a higher level. And so it's almost like a little exercise machine for your lungs. And it's very inexpensive. You can get it on Amazon as well. I think I paid $9 for mine. But those are the types of things that you do to get your health back. You know, you've hit a speed bump, so to speak, and now how do you get back up and keep going? And that's what that's for. So we're very excited to be able to offer these types of services, and I call it bones or skeleton or infrastructure, you know, within Brighten Heights, so that we can empower residents to be successful long term. So now what I'd like to do is highlight what's coming up for next month. So next month is Alzheimer's, I believe it's Alzheimer's Awareness Month. And what better time than next month to bring Dr. Dale Bredesen on and interview him. He is really the pioneer in taking Alzheimer's and number one, not being afraid of it. And number two, applying all these lifestyle medicine related strategies to prevent it, slow it down, and even reverse aspects of it. And so, Dr. Amber, I want to let you talk a little bit more about that, because we're excited about it, but you know him very well. You've been working with him for a long time and using his protocol in your practice. So if you could share a little bit more about that and kind of what to anticipate. And also, I know he's got a new book that's come out as well.
Yes, I'm very excited. I was just communicating with Dr. Bredesen this morning, and he's flying somewhere, doing talks all over the world, really, right now. And you know, he has his new book out, and of course he's just really impacted the lives of so many individuals with his research and his approach with the goal of ending Alzheimer's, right? The end of Alzheimer's, right? So that's what I've been all about clinically ever since I had the distinct pleasure and opportunity of training under Dr. Bredesen about 7 years ago. I gained insights into the amazing intellect of the man, but also the substantial amount of compassion and caring that he has for his patients, for teaching other doctors how to do these things. And so he has single-handedly had the greatest impact on the general world of Alzheimer's risk by training many thousands of doctors and other health professionals the underlying tenets of what actually causes Alzheimer's. And you know, one of his biggest lessons to me, which totally fit into my general construct of lifestyle medicine historically, was that when you're dealing with a condition like Alzheimer's, or really any form of dementia, it's like walking into a building, a huge building that has over 30 holes in the ceiling, in the roof. Okay, and then asking the question, well, which hole do I need to fix in order for this building to be a functional building again? See, so too often researchers and doctors are asking the wrong question. Okay, as I alluded to earlier in this session, the question that we should be asking is, what else can we do? How many other holes are there that I can discover and fix to make this building, this structure, this body, a functional system? What are the other underlying triggers of cognitive decline that are severely impairing my own brain's ability to do the things it used to do so easily? And so those are the questions that we ask, and that's the purpose of what we call the Bredesen protocol, which is to discover as many of the underlying triggers of a condition as possible, and not to just normalize them, but to optimize them. Because what happens in medicine so frequently is that we're satisfied with what's normal, before we realize that it's normal to get Alzheimer's, it's normal to get heart disease, it's normal to have strokes, normal as in statistically average. And so we can no longer be satisfied with normalizing risk factors, because that just means that we're going to have the normal rate of that disease, which is unacceptable. Okay. And so the more we optimize, the greater our potential is to not only slow the progression of cognitive decline, not only stop the progression of cognitive decline, but even begin to reverse aspects of that cognitive decline. And so I am so excited that Dr. Bredesen, who's not only my mentor, but a good friend of mine. I've been involved with research projects with them. We published several studies in the past years on the power and the reality of reversing cognitive decline in many patients. And so it's going to be fun being able to interview Dr. Bredesen. So Susan, you and I are going to have a good time asking questions.
Yeah.
And just dialoguing with this amazing personality who has literally trained doctors all around the world, and he's seen so many things, so many individuals who've had not just early symptoms, but even advanced conditions with Alzheimer's. He's seen them dramatically improved, and so it's going to be the appropriate time during Alzheimer's Awareness Month in November to have him with us on November 8th to basically ask questions. So if you have some questions, make sure you're on the program early and you write in your questions in the chat. And I don't know if we'll have opportunity to even take questions through our website ahead of time. Maybe we can work that out so that we can have some questions that you want to have asked as part of the questions we ask him during the program.
Well, very good. I'm excited about that. And that program, as you mentioned, it will be on November 8th, which is again a Monday at 4 p.m. Eastern, which is 1 p.m. Pacific time. Anyway, well, thank you for joining today. It's been a great session. I hope that this has been informative for everybody. And just as a reminder, Brighten Heights will be a senior living community where seniors will be empowered to live a healthy and active life with purpose. Thank you again for joining, and we will see you next month. Take care.
Goodbye, everybody.